Hi viewers, welcome everyone. Today let's discuss about repair of periodontal tissues. Before that, we need to understand what is healing. Healing is just the body's response to an injury in an attempt to restore its normal structure and function. So this process of healing involves two distinct processes. One is regeneration and other is repair. Regeneration means it's a complete restoration of the original tissues, whereas repair means it's a fibrosis and scarring. So this repair results in fibrosis and scarring. Let's see some of the phases of the wound healing. First is hemostasis, that we know when there is any cut or any injury happens, immediately the blood will come out from that space, and then the platelet will come, and then the blood clot will occur, then that seal that area. Let's imagine this is an injury, so immediately the blood will come out and fill the space, and because of the platelet action and blood clot will form and seal this area. So this is hemostasis. And next process is the inflammatory phase. Here, when I explained about those who have not seen the video of inflammation, you must go and check it out, then only you will understand this area better. So that is a basic. So you first understand that better and then come to this video, then you will understand easier. But I will explain now just briefly that when so now the blood clot has happened, then immediately the inflammatory cells will come out from the blood vessels with the help of, that means immediately after the injury, the first cell that will arrive to that place is a mast cell. So these mast cell, they release certain chemicals such as histamine, leukotrienes and prostaglandin, and these chemicals, they act on the surface of the blood vessels, and they release because of that some process of margination and diaperesis occur, and due to that this neutrophil and macrophages, they come out from the blood vessel out, and they go into the space into the tissues where it is required. So that is a process that happens. So these neutrophils and macrophages are the phagocytic cells. They phagocyte the dead cells and everything. So due to this action, we can see the signs of inflammation on the area. They are the redness, swelling, heat, pain and loss of function. These all are the inflammatory signs. We can see these inflammatory signs on the cut area. And next is the proliferative phase. Means that area has to close, because now the area is this, the tissue has this much of width, the space is more, so this area has to fill with this. So now the epithelium has cut, the connective tissue has cut, so this area has to come back to its original position. So that first they need to build a new connective tissue. So the connective tissues are made up of collagen. These collagen are synthesized by the fibroblast. So the new connective tissue begins that area. So that is known as the granulation tissue. Because of this macrophage, so I just told you, now the macrophages have come out from the blood vessel, and these macrophages, they release certain growth factors, and that leads to the activation of fibroblast, and this fibroblast, they release certain extracellular matrix. They are the collagen and the other glycosaminoglycans, fibronectin, all these. So this blood clot, fibroblast and new connective tissue, extracellular matrix, these all together, they form the granulation tissue. This is the new connective tissue. They begins to form approximately 2 to 4 days. Then these all come under the proliferative phase. The first granulation tissue happened, then the blood vessels, everything has cut, no, the capillaries. So the new capillaries has to form, so that they can supply the oxygen to that area. So that is happened because of the sprouting, endothelial sprouting. So now the wound periphery has the intact capillaries, and they derive the endothelial sprouts, and they grow, and eventually they interconnect and generate the new capillaries. And next is the contraction. This occurs about around 4 to 5 days after the wounding. This characterized by myofibroblast. So this myofibroblast are the modified fibroblast. So they this myofibroblast, the differentiation occur between 6 and 15 days after the wounding. Then this after 15 days, about 70% of the fibroblast in granulation tissue express a smooth muscle actin, that is the myofibroblast action. They provide a mechanism to stop the fibroblast migration, because these all fibroblasts reach their destination. So this has to stop the flow of the fibroblast by the help of this myofibroblast. And after that, this myofibroblast, after the when the contraction stops, this myofibroblast disappear because of apoptosis. So now the scar becomes less cellular, and new fibroblasts with properties typical to the normal connective tissue fibroblast emerge. Next is the epithelialization. This is the reconstruction of the injured epithelium, begins almost immediately after the wounding. So now you can see this is the basal cells. These are the epithelium and basal cells. So 24 hours after the initiation of cellular migration, these basal cells at the wound edge, they begin to proliferate, and they contribute the additional cells to the healing monolayer. And this epithelial cells, they start to migrate, and see, now you can see the cells, they will start to migrate and continues until the overlap is achieved with the other epithelial cells migrating from other area. So at that point, when these two migration has finished, then contact inhibition occur, that leads to the cessation of the cellular migration. So you'll understand better by seeing this picture that the proliferation of the cells occur from this side and from this side, and they meet, and the overlap has finished, and then the contact inhibition occur, and that helps in the cessation of the cellular migration. So this is about epithelialization. So the proliferative phase, four processes are happening. The first is the granulation tissue and the new connective tissue formed. Then angiogenesis, because of that the new capillary has formed. Then contraction occurred, so that the the space has become less. Then the epithelialization happened. And next is the maturation phase. In that you can see the remodeling. Here the scar remodeling begins to predominate approximately 21 days after the injury. Here the collagen synthesis is very less, that rate is less. So the nature of the wound matrix, that changes with the scar remodeling. So now the immature scar contains a disorganized array of the collagen fibers that gradually replaced by the thicker fibers. So they arranged in an orientation paralleling stresses. So this is all about the phase, four phases. So if you see this picture, you'll understand little more better. This is just a summary. So because of the inflammation, this first the wound filled with the blood, hemostasis occurred, blood clot happened and sealed the wound. Then the blood vessel dilate and bring more cells like neutrophils and macrophages into the area, and the wound became red, swollen, hot, and all the cardinal signs can be seen. And then proliferation occur, like the granulation tissue formed, which is caused by the fibroblast into the area, and then new epithelial cells occurred. Then new collagen, everything has formed, and now the new connective tissue happened. And next is the remodeling, that is the scarring. So these are the stages. You should not forget these all. These are the stages of the repair. And next is there are two types of healing are there: primary intention and the secondary intention. The healing by primary intention and healing by secondary intention. First is based on, so certain features are there. The nature and size, when we consider the nature and size of the wound, in the primary intention, it is clean and uninfected wound and minimal tissue disruption, and edges are opposed. When you see this picture, you'll understand better. Now you will see the wound is like closed with surgical intervention, so edges are brought together. So it's the best choice for clean and fresh wounds in sufficiently vascularized area. This is clean, and the space is the wound space is less, so that it is easy to unite themselves. So such type is the primary intention. Then whereas in the case of the secondary intention, it is the wound gap is so large, extensive tissue loss has happened, so this may be infected. Sometimes this is the infected edges that cannot be approximated. So now you will understand the difference by seeing how the wound would be, primary and secondary. And the steps in healing, here both the cases the clot will form, here the small clot and here the large clot. Of course that wound would be large, so the clot also would be large, and the inflammation is not intense here, here more intense inflammation, here less exudate or debris or anything, here it is more. Neutrophil can be seen at the wound margin within 24 hours, and after 24 to 48 hours then this basal cells at the edge show increases mitotic activity and migrate and proliferate to form the continuous layer. Here the secondary inflammation mediated injury, because that's a big wound, no? So that's why. The next is a granulation tissue formation. Here also granulation tissue will form, that is small, here it is large. Scar formation, here it is less scarry, here greater mass of scar tissue. But the only difference between these two mainly is on the about the wound contraction. This will happen in beaks, because here it is absent, because we just talked about this now, about the appearance of myofibroblast that is required. Myofibroblast is required for the large wound, because they need to contract that gap. So thus myofibroblast role is required here, but here it is not at all necessary. So here scar contraction formation of a network of myofibroblasts. This is a major difference between these two. Almost all the other processes are a little bit same. Here it is small, here it is large. That is the only difference. So this is all about the repair of the periodontal tissues. If you have any doubts, you just mention in the comment section. Thank you.